Uh-oh, looks like you just took a nasty spill. You better call an ambulance. But before you do that, let me just tell you. In America, an ambulance ride costs, on average, $400 after insurance. Even worse, a study by the University of Michigan found that over 70% of ambulance providers don't accept the patient's insurance. That leaves most rides in an ambulance costing over $1,000. That's why many people choose to call an Uber, or Lyft, or call a friend when there's an emergency, rather than calling 911. Most developed countries don't charge for this service, but that's just the beginning. Once you reach the hospital, every item and every service you receive is an itemized expense. Furthermore, if you end up being diagnosed with a chronic condition, you're in serious trouble. Life-saving drugs in the US can cost 10 times what they cost in other countries. For example, one vial of insulin costs about $32 in Canada. In the US, it's $300. This is why 500,000 Americans go bankrupt every year due to debt accrued from medical illness, and why we see so many people asking for money to cover their medical bills on GoFundMe.
This medical journey started 10 years ago, and so I've had to augment my income with my financial reserves as my health did not allow me to create enough income.
I haven't been able to work because of this, and it caused some problems to come up. Like I can't pay my dentist bill anymore. I can't afford food or anything like that. So I need help.
More than 300,000 people are using GoFundMe accounts this year to pay for healthcare when insurance can't.
One of America's most popular shows of all time revolved around a well-mannered middle school teacher who turned to selling meth when he was unable to cover the cost of his cancer treatment. Heisenberg, anyone?
You're goddamn right.
America spends more money on healthcare than any other nation on Earth. Around 16% of its GDP. On average, it amounts to about $10,000 per capita, and yet our life expectancy is lower than in most other developed nations, and it's still decreasing. The high costs are largely due to the privatization of our healthcare. Private insurance companies cover relatively few amounts of people compared to a system like Medicare or Medicaid or the VA, and each one must negotiate prices with the hospitals and doctors on their own. These companies, the pharmaceutical companies, and the rest of the healthcare system can charge whatever they want and increase prices whenever they feel like it. That's not to mention the gaps in insurance coverage. Currently, over 27 million Americans are uninsured. And if you're uninsured, nobody's negotiating on your behalf, and you pay the highest price. Many Americans end up without insurance because they can't land a full-time job, and paying for individual coverage is unaffordable on part-time wages. Because it's tied to employment, lots of companies will work and employ 35 to 39 hours so they aren't obligated to provide them with health insurance. Even if you're paying for insurance though, some plans have high annual deductibles, meaning you could end up paying $4,000 or more before your insurance kicks in.
So with that being said, I ended up with some exorbitant medical bills. I do have insurance, but it is catastrophic insurance with an extremely high deductible, and that hospital bill did not meet that bare minimum deductible, so I'm facing $5,580 that I have to pay to the Order of Holly Hill.
In 2017, nearly half of all Americans said it was difficult to pay their medical bills before meeting their deductible. A single-payer system eliminates a lot of these problems because it covers everybody, is administratively simpler, and allows the governing body to set the prices of drugs and services.
We're eliminating the profiteering of the drug companies and the insurance companies and ending this Byzantine and complex administration of thousands of separate healthcare plans.
Let's look at one of those systems.
We are the NHS. We are recruiting now. Search nursing careers.
In the UK, every citizen has access to the NHS system, regardless of profession or income. They receive everything from primary care to a full range of specialty services at absolutely no cost at the point of service. The NHS spends less than half of what the US spends per person, despite having better health outcomes. People in the UK suffer from much lower rates of chronic disease, and their life expectancy is longer. The NHS is not without flaws. In fact, many consider it one of the worst healthcare systems in Europe.
We see patients every day that need a service like this. So it's very frustrating as an NHS doctor that now I can't help those patients.
Different administrations intent on cutting costs and increasing efficiency have resulted in a weakened system and declined quality. Looking at you, Tony Blair. But it's about more than just money. Many European countries have regulations that serve to prevent health complications. For instance, sugar and its contents are heavily regulated. The UK even has a sugar tax and has banned the advertising of candy or sweets using cartoon characters or any methods that target children specifically.
And they have the one-of-a-kind taste kids have made their own. Kellogg's Frosted Flakes. They're more than good. They're great!
Most European nations also have a high tobacco tax. There is an interest in how healthy or unhealthy the products consumed are, and they have subsidized fitness initiatives for adults and school children. The US healthcare system relies on people getting sick and receiving treatment, resulting in virtually no investment in public initiatives. In the US, we treat healthcare like a privilege that you earn through hard work. It's almost like if you're poor, then you don't deserve to be healthy. But healthcare should be considered a basic right. It's an essential part of well-being. If you live in America, you shouldn't go bankrupt paying a medical bill. All Americans should be able to see a doctor when they need to, and they shouldn't have to pay $600 for an EpiPen. However, it is possible that a top-to-bottom federal centralized public health system may not be the answer. We would need to be willing to allocate the resources into a system like that and most likely pay more in taxes. The Swiss are willing to pay 10 to 15% of their income into healthcare. But would Americans be okay with this?
But the Prestons like the care they get, and they like buying into a system that protects everyone.
New Yorkers went bananas when Bloomberg tried to implement a soda tax.
This is raising a lot of eyebrows.
It really is. I mean, this is big. This is a dramatic measure. You know, the mayor is saying this is about helping people lose weight because more than half of all of the people in New York City are obese or overweight, and that number is only growing.
Something like the systems in Germany or Austria might be a better approach. There, healthcare is federally mandated and subsidized, but the reins to the system are handed over to the individual states. We already have evidence for the efficacy of Medicaid in many states for those below a certain income threshold. A statewide public healthcare system would be more efficient and more in touch with the people they oversee. Unfortunately, for-profit hospitals, drug companies, and private insurance companies would likely suppress any attempts to pass such legislation, and they have incredible sway over Congress.